good afternoon or good evening, everyone. My name is Dr. Courtney Ray, and welcome to our second week of our Black Luminaries in Neuropsychology series. We want to kick off this evening with saying thank you to everyone for being here, and also we wanted to let you know that we are going to be doing this every Tuesday and Thursday in the month of February. So tell other people to come and make sure that they are here. If they're able to be here for the live sessions, we would really appreciate it, because then you'll be able to talk face-to-face with our luminaries. But even if you aren't able to do that and be in our live sessions, you're able to watch it afterwards. So if you're watching this afterwards, we're thankful that you got a chance to make it with us. Right now, we want to start off with an Ancestor Spotlight, because even as we are looking at our luminaries in the present day, we also want to honor those who have come before. And so the first person that we want to honor today is Dr. Hope Landrine. Now, Dr. Hope Landrine is a psychologist who was born in Yonkers, New York. So for all you New Yorkers out there, she's representing. She was born in 1954 on July the 4th, on Independence Day. Dr. Landrine was a professor emeritus from East Carolina University, where she was the director of the Center for Health Disparities and professor of psychology and professor of public health in the Brody School of Medicine. She earned her bachelor's degree in psychology from Westminster College and her doctorate in clinical psychology from the University of Rhode Island. She completed a postdoctoral fellowship in social psychology at Stanford University and a National Cancer Institute postdoctoral fellowship in cancer prevention and control at the University of Southern California School of Medicine. So cancer research is actually something that Dr. Landrine has in common for our special guest this evening. Prior to Dr. Landrine's positions at East Carolina University, she was the director of multicultural health behavior research at the American Cancer Society. A prolific scientist, Dr. Landrine published more than 125 articles and books. She dedicated her career to understanding the health and social conditions of African Americans and other ethnic minority populations. Dr. Landrine's research in the health psychology and public health fields was pioneering and pathfinding. Her focus on ethnic minorities, specifically those living in segregated and poor neighborhoods, is a significant corpus of work that provides a challenging perspective on social justice and healthcare. She earned many notable honors for her life's work, including the fellow status at the American Psychological Divisions 9, 45, 38, 35, and 50, all for her outstanding contributions to research on social issues, racial and ethnic minorities, health, women and substance use addictions, and she was also awarded fellow status in the Society of Behavioral Medicine. In 2012, she was honored with the APA Division 45 Lifetime Achievement Award for a distinguished lifetime contribution to research on racial and ethnic minorities. In 2019, she was awarded the James M. Jones Lifetime Achievement Award for her exceptional contributions to the understanding of racial and ethnic psychology. She passed away in Greenville, North Carolina on September 3rd, 2019. And so we want to honor Dr. Hope Landrine for her trailblazing in research, in psychology, and for our community as Black Americans. And so I'm just so grateful that we got a chance to honor her and the wonderful work that she's done throughout her lifetime. I know that many of us are unfamiliar with all the different things that the people who have come before us have done and how much they have contributed to this field and how much we are able to stand on their shoulders. And so Dr. Landrine is one of those individuals. Speaking of individuals whose shoulders we stand on, I am happy and grateful tonight to introduce you to someone who is not only a trailblazer in general, but very specifically our guest this evening. And I have a personal connection, and I can very directly attribute the things that I have done to her mentorship and her ability to help teach with excellence in the area of neuropsychology. And so I want to introduce you this evening to Dr. Natalie Kelly. Dr. Kelly, how are you?
Hear me?
Yeah, we can hear you.
Hey, wonderful. Hi, Courtney. Thank you so much. I'm so grateful to have this opportunity. Hello, to everyone who's watching. Thank you. I'm happy to be here.
And I'd like to read a little bit of your professional bio. So, Dr. Kelly is a PhD and she has her ABAP-CN, and she's a clinical neuropsychologist in the Department of Supportive Care Medicine. And you're at City of Hope Hospital. You've been there since 2011. Dr. Kelly is double boarded in clinical neuropsychology and as a subspecialist in pediatric neuropsychology. Now, before we came on, Dr. Kelly and I were trying to figure out whether or not she is currently the only double boarded neuropsychologist in both general clinical neuropsychology and also in specifically pediatric neuropsychology. We're not 100% sure if she's the only Black double boarded person in these two fields, but she was among the first to be board certified in the subspecialty when they began doing this, when they opened it up. So we do know at least that you were in that first cohort, but whether or not anyone else has since joined you who is Black also, we are not sure. So if you know another board certified neuropsychologist who was board certified in a subspecialty of pediatric neuropsychology, let us know, because so far, you're the only one that we know about.
Let us know. Let us know.
So let us know if there's someone else.
Right.
You received your Bachelor of Science degree in child development at Vanderbilt University. Then you went on to earn your Master of Science and your Doctor of Philosophy degrees in Clinical Rehabilitation Psychology from Indiana University, Purdue University, Indianapolis. Dr. Kelly completed her clinical internship at the Children's Hospital of Michigan and postdoctoral fellowship in pediatric neuropsych at Cincinnati Children's Hospital Medical Center. You conduct neuropsychological assessments with both pediatric and adult patients at City of Hope. Dr. Kelly is also the director of the Neuropsychology Clerkship and trains local doctoral-level psychology students in all aspects of conducting neuropsychological evaluations, which is how I know you, because I was one of your neuropsychological clerks. Dr. Kelly serves on several hospital and departmental committees as well. Her research interests include understanding cognitive concerns in the adolescent and young adult population across cancer diagnoses groups. And so, as I talked about Dr. Landrine and her achievements in her interests in cancer and psychology, that we know is one of your interests as well. And can you tell us a little bit about what is City of Hope, because you're there? Can you tell us about the specialty that City of Hope has as a medical center in Duarte, California?
Okay. So yes, at City of Hope, we are a national cancer center, and see, I recognize cancer center, and really although we see patients really across a range of oncology diagnoses, primarily tend to be blood and lymph cancers. And the hospital is quite known for providing transplants. So patients who maybe have a complicated leukemia that, for example, may require transplant, that's sort of the specialty of City of Hope in some ways. And then I'm at the primary campus where I've been just 10 years. Last month marked my 10-year anniversary. Yay. But we've also been expanding within the region very recently, within the past several years. So a number of new kind of locations throughout Southern California, and turning more into a network of practice locations, with the Duarte campus being the main one. So and my role here primarily is Clinical primarily, but I do a lot of different things. And so, yes, my focus is on the cognitive needs as patients either go through or are actively on treatment, after treatment, across the lifespan. So I am pediatrically trained, of course, but here I do get to see patients, I say a range of 2 to 102 in terms of my clinical practice. So.
Awesome. So, Dr. Kelly, you said that you see patients across the lifespan, but you particularly are boarded in the subspecialty of pediatrics. So, what exactly drew you to neuropsychology in general,
Okay.
and specifically into peds?
Okay, so that's a wonderful question. So, neuropsychology in general. So, I first heard about neuropsychology when I was an undergraduate student at Vanderbilt. So, I was in a child development course, and you have your basic intro psychology courses, and neuropsychology was one of those psychology specialties that we read about. That first piqued my interest, and then several other things happened that kind of solidified it. So, one would be Oliver Sacks actually came to speak while I was an undergrad at Vanderbilt. We had a series of talks, and he came to speak during one of those, and I was just amazed and just he was of course a behavioral neurologist, but just amazed with the work that he did, and that link between brain and behavior was just so fascinating to me. And so moving from that, I then heard more about neuropsychology in the rehab world because my mother actually was a physical therapist. And so being connected to the rehab world that way, I learned more about neuropsychology. I remember she had a newsletter that came home, kind of professional bulletin, and it had a big brain on the cover, and it said neuropsychology. I was like, what's this? Or I've heard about this in my class, but I think I was maybe a sophomore or junior in undergrad. So that really piqued my interest in the field and just continued on from there. I mean, so I did know pretty early on that I wanted to be a neuropsychologist even before I graduated from undergrad. And then the pediatric piece, I've just always been a person that loves children. Back when high school or middle school, I thought I'd be a pediatrician. I've just always known that I wanted children to be at the center of my work. And so that drew me to the specialty specifically.
Well, that's very interesting because
Mm-hmm.
I know that a lot of people don't even hear about neuropsych as a subspecialty of clinical psychology until they get to graduate school. Like,
Right.
there's a lot of people that have heard, and even people who are in SBN who said, I actually didn't know that neuropsych was a thing. And so that's so interesting that you actually not only had heard of it, but decided, hey, this is something that I want to do even while you were in undergrad. So that's very unique. And then also, as many of our colleagues, we talk a lot about research and a lot of the things that people are super interested in, even whether or not it's a specific subspecialty or not. Most of the people who I talk to in my network are almost all of them are geriatric in some way, or they work with dementia patients or Alzheimer's. And so Alzheimer's and geriatrics is a big deal in neuropsych, as it should be. But very few people that I know personally are very into pediatrics and want to do pediatric work specifically. And so I think, like I said, I think that you are the only board certified.
But let us know if you're out there. Let me know. Reach out.
We don't. If you know of somebody else, please let us know. But I think that it's a place that, in particular, I mean, neuropsych in general is a place where we need to increase the diversity within the field. But in pediatrics specifically, I think that there is sort of a definite need to get more diversity, more representation in that specific subspecialty, because so many of the people because I do a private practice with people across the lifespan, and there's a lot of people who come in with their children, and so many of the people in our community are concerned about their children and what is going on and the different cognitive sequelae that's going on, and they don't necessarily have somebody who looks like them to choose from.
Right.
They are across the desk from someone doing these assessments and getting evaluations, getting advice and feedback, and knowing that cultural competency is important, and having someone that they can see and relate to is really important as well. So I see a couple of comments in the chat. And George Cherry says that he wants to do pediatrics. So I don't know.
Yay!
I don't know if that was something that he had been inspired to do from before, or maybe just now. You know what? I'm going to do pediatrics. But whatever inspired you, George, we're glad for it. We're glad for it. So, and Dr. Mint is also in the chat, and she was saying how it is so needed. And earlier when we were doing the honoring our ancestor part of it, she was saying that that's something that she appreciated. And I want to know from you, Dr. Kelly, who is someone who you consider someone who has either mentored you, or maybe you weren't directly mentored by them, but maybe somebody who inspired you from afar, who you felt that you wanted to, or who gave you some sort of inspiration in your career path?
Okay, so I probably would choose, one person would be Doug Riss. So Doug Riss is one of the fathers of our pediatric neuropsychology as we know it, author of many textbooks. Anyone in the peds world would definitely be familiar with Doug's work and research. And he was the person at Cincinnati who gave me the phone call and said, hey, do you want to come here for fellowship, and open that opportunity for that specialized training. And he was at Cincinnati for a portion of my fellowship training time. And just in that time, and even since, he's always been someone who has encouraged me. It's been a while since I've spoken to him directly, maybe a couple of years, but someone who always encouraged me, always guided me. He just has seen so much and has worked with so many, up and coming trainees. He really just had a way that made you feel like, okay, I can ask him anything. Yeah. And that was very inspiring to me as an early fellow, my early fellowship years. And then I am going to give a shout out to one of my mentors also from Cincinnati Children's, Dean Beebe, who has just throughout my career been a cheerleader. Even today, he sent me an email saying, I see you're going to be on there, and I'm just so excited. And he's just a tremendous person, teacher, incredibly bright, and incredibly supportive of me from fellowship even up until today, this very day. So those two individuals particularly have been very, very supportive of me.
That's awesome that you said that you have that connection where you still talk to some of the people that have inspired you, and you have that. Do you feel like that has been helpful to you kind of throughout? Like, have you been the one to initiate that, or have they, or have it been sort of a mutual thing?
I think it's sort of, if I reach out, they're always there. For I would say for Dr. Beebe, it's more of a mutual, like, he'll reach out, I reach out. And for Dr. Riss, it's certainly had been something where if I reach out, if I saw him at a conference, he was always, happy to see me, happy to talk. And just knowing that you have someone that knows where you were and can see how you're growing, having someone be there in that sense is very helpful. Just in terms of building your sense of confidence as a trainee, as developing your own identity as a neuropsychologist, when you really feel like you're faking it, you're like, I'm just pretending, eventually I'll be real. Right. So it is really stabilizing, I think, to have those people in your life. And even now, I have a mentor here in my current position. She's a neuropsychologist, Dr. Sunita Patel, who's a researcher in pediatric oncology, and for me has been a person who I can always currently, it's just so important to have a mentor, I think, at every step. Have someone who you can draw from, learn from, get guidance from, objective input. She's even helping me right now, sort of at a crossroads in my career, figuring out what really matters to me. Where do I fit in? What matches my goals, and what are the next steps toward that? And I think really in any stage of development, we all need that person or those people who are going to look to us and know us and provide us that guidance when we need it.
That's awesome. That's awesome.
Yeah.
And that's interesting that you say that even now at this stage in your career, still see the need or the desire to have somebody to be that person for you. And I guess I wonder, I know that there's a lot of people who are at various levels of training or their professional career. How do you find someone who you can have that relationship with? Do you just go up to someone and say, hey, I want you to be my mentor? Like, how does that exactly happen?
Right. So it may be trial and error, but I think at first you take a look, you observe someone's work, right? You look at you maybe observe them from far away. Check out their personality characteristics, check out their communication style. Are they someone who is present or maybe seems really busy or maybe not so busy, maybe grounded and more attainable, and you can get that time with them. And then think about what your needs are, because some people maybe only need someone that they can reach out to, maybe twice a year, and have that, or maybe you're looking for something more regular or more in depth. So kind of I think observing that person's career, that person's work, talking to others who know that person, and then of course reaching out to that individual. And I think sometimes though it's sort of serendipitous in the sense of, you're going through training, maybe you meet someone at this institution, or someone on at this training site that maybe on a practicum or a clerkship or internship that really spoke to you. But I think one of the key pieces, no matter how you come across this individual, is finding someone that you have you share the same goals. Because, and what I mean by that is, you want someone who's going to help you, of course, move to that next step, but also I think invest in you as a person and who also wants to learn from you. I really see mentorship as a partnership, it's a dynamic. It's not just necessarily this person guiding me and telling me I should do this. What can I also give back to that person? I get so much from my trainees, my previous students, and I know I've been able and been blessed to help them along their pathway too. So I really feel like it needs to be this exchange. That's where I find the meaning in it. I know it may be different for everyone, but that's where I find the meaning in it.
Yeah. And that's interesting. I just before your interview, so last Thursday, I was talking with Dr. Anthony Stringer, and he actually echoed the same kind of sentiment, the idea of having a relationship that goes in both directions, where you and your mentee or your student is able to give each other information. So you as a mentor are able to pass that to your students or your mentees, and you as a mentee are able to pass that on to your mentors. So it's not just a one directional thing. And I think that that's really great that you also have kind of that same philosophy. And I know that personally, but this is for the for the wider audience.
Yeah.
But I do know personally that you do practice that, as you are saying, and so that's really awesome. What are some of the things that in the past, in your career right now that you're looking towards? I mean, how have you kind of changed your trajectory, or maybe grown into a different direction in maybe research, or maybe in what you want for your goals professionally, or something like that? Like, are there adjustments that are made? Because you seem pretty sure when you were in undergrad, like this is what you want to do. And so, I mean, are you like, hey, I knew this and I've always done this, and this is kind of what I want to do, like until I retire, or have things changed in your path before, and might change in the future, or what?
So that's a really good question. So yes, in the beginning, I knew just what I wanted to do. I am so very grateful that really every day I get to do what I've always wanted to do, right? I mean, to have a job that is not just a job, like this is a career, it is a source of meaning. I really am doing my dream career, and I'm so fortunate in that way. And when I started off, I was kind of just, you start off. I'm the type of person, probably many of us out there are, where you follow the rules and you do the steps, and you got those goals. I need to, pass my prelims, and I need to do this, and so you just mark those steps and you go through all of them. And then once you get to a place where you realize, oh, I've kind of done this piece. So you know, I've done lots of assessments, and that has been wonderful. I think I am now at a different place in my career. Maybe that I'm at that early mid-career, just hitting that 10-year mark, where you start to think, well, what do I want the next 10 years or 5 years to look like? And I have started asking myself those questions of, where can I contribute in a different type of way? Not that, the clinical work and the one-on-one interactions with my patients are just amazing. I mean, particularly here, I'm just so grateful to work with. I don't know how it happens, but I tell everyone, like, I have the best patients in the world. They really are just amazing people. And that has been such a blessing. But you start to think, well, I'm ready to grow, right? We're growing, we're changing. And I think at this point in my development as a woman, as a human being, I'm thinking, well, what else? What else is out there? What else can I do? And I'm looking towards opportunities. So growing in opportunities to mentor others. That's been a place that I'm really looking for, that, because I want to provide that line or that connection for others, where maybe I didn't have it as much at certain points in my career. And then I'm looking to, think about, how can I contribute in a research type of fashion, through multidisciplinary connections and opportunities. Just in terms of my position here, I don't have my own lab or research funding or things like that, but I've been able to kind of.
Uh-oh. I feel like you got frozen there for a second. I'm not sure. We were getting so good. I'm not sure.
Okay, is it better?
Yes, yes.
Okay, sorry. Technology.
Technology, right? Exactly.
What are we gonna do?
But the thing that I heard was, you said that you don't have your own lab or anything, but
I've been able to reach out and find opportunities for connecting with colleagues, multidisciplinary opportunities to collaborate. And I'm definitely at that point in my career where I feel like I want to contribute to the discipline too. Like, what can I add to neuropsychology? What can I add to the field? Thinking about a legacy. What would I like to be remembered for? And maybe, hopefully that won't be for a long, long, long time.
right.
But you start to think about that. What am I going to leave behind? What am I going to be remembered for? And those are just some of the things I think at this point you kind of transition towards in your careers.
And I think that those are really interesting questions to think about, because I think all of us get to a point where you're like, well, is this what I want to leave behind? And I think that that's really great. You talked about your relationship with your mentees and your students and the training program that you're in charge of. And also, you touched a little bit on your research. Could you tell us a little bit more about, like, what are some of the research things that you do, and kind of a little bit more about cancer neuropsych? What exactly is the kinds of things that you're looking to do? Yeah, and interested in.
Well, right now, so we have the research work that I'm just really starting, kind of building towards, is in a multidisciplinary collaborative clinical program that we have here for adolescents and young adults, or what's also called AYAs in the oncology literature, so adolescent and young adults. We're developing clinical pathways to implement psychosocial screening for these patients, because often in AYAs, psychosocial needs are overlooked sometimes, and they're at a unique, again, developmental phase. And the developmental part of me, the pediatric neuropsychologist part of me, is thinking, what are the aspects of their development that are being affected by cancer? There's so many, in that transition between. So AYAs typically are are identified as 18 to 29 or 18 to 39, depending on the criteria. And so there's a lot of independence and autonomy is being developed. And so our clinical pathways are really just really getting established here over the past year, and how to best support and screen those patients, and then thinking about building a research program that gathers that data so we can understand the psychosocial needs, how to meet those needs. And so that's kind of the focus that I've been developing. And I've been involved in AYA work clinically at City of Hope since about 2012, but we're really kind of been taking off over the past year or so.
Yeah, awesome. Because I mean, that is such an overlooked population in general. But then when you're talking about specifically in people who have been diagnosed with cancer and those kids who are preparing for treatment, whether it's chemotherapy or maybe they're looking for transplant, all that kind of stuff, that's really an interesting, in-depth kind of area. And so I'm glad that you're doing it, and it seems really, really interesting. I'd love to even know a little bit more about that. Maybe we could talk after this because I think that's super interesting. But we do have some questions. Those of you who are watching right now, feel free to ask your questions in the chat. Let us know what you would like to ask Dr. Kelly about either her life in neuroscience. Yeah, just all of your life, just be an open book. But her life in neuropsych, or about her research in cancer, or in peds, because those are things, like I said, are pretty unique, and not everybody does those things. And so it is really interesting to find someone who you can talk to and pick your brain about some of that interesting stuff about both psych in cancer research and psych in pediatrics as well. What made you particularly get drawn to cancer? Because it's not necessarily a happy kind of
right. Sure.
area.
Yeah. That's a very fair question. It's not, and so that piece, the oncology piece, wasn't something that I necessarily said, oh, I want to work in oncology. Not when I first, started out. I didn't even really know. And my research in graduate school was all epilepsy. So I thought, I would go the epilepsy path, in terms of practice or work later on. But on fellowship at Cincinnati Children's, I did have 1 year of neuro-oncology. So there was lots of brain tumor work clinically there. Became very interested in that, just from the anatomical perspective of brain tumors and just the sort of, nerd part of neuropsychologists. We and want to understand the brain. We think it's very interesting and fascinating in those aspects. So that drew me in, and those cases were particularly just really intellectually stimulating. But certainly there is the emotional component that comes up in cancer that would, to some degree, across in neuropsychology, across different diagnoses, right? We're dealing with neurological conditions that are, typically very profound and impactful for families, and but cancer certainly being one of those that kind of stands out in some ways. So I think fortuitously had the opportunity to, I was looking for jobs specifically in Southern California, just for personal reasons, family reasons, trying to come here with my husband. And so this job opened up, and I was a good fit because I had oncology experience in fellowship. And then what sort of kept me in oncology, because certainly you can start something and say, well, this isn't for me, but I've stayed because I've found a real connection to the patients here, and then also my team here. It's very much oncology work, I think, brings a real team aspect that, and of course, I don't have anything directly to compare it to because this has been my main my job since fellowship. But there's just a unique sort of connection that we have, and that team-based work has really, in many ways, encouraged me just continue in this path, and really, because you feel like, or I've felt like I can also offer some hope to families, because quite often I'm trying to support, maybe adolescent getting back in school, or getting into college, or getting support in college, or pediatric patients just trying to get the needs that they have academically. And I feel very useful in a sense of like, yes, this documentation can really be a tangible support. And so that also has been very just rewarding and encouraging in that way. But the team aspect is also crucial when those times, when it is difficult, and we do lose patients. Certainly that has happened, and will continue to. But we have that collegial and really almost like second family support here. And I have a really unique situation. So, yeah.
Yeah, and I can say just from experience in working at City of Hope in comparison to other places, and I loved all the different places that I was a neuropsych clerk at, and I did my practicum at and externships. Those were all great, but I will say that there was something unique about City of Hope in that, because everyone is sort of rallying around this cause. You are working not only with the patients themselves, but also the families in many different aspects. And there is an aspect of, we want to get, like, it definitely lives up to its name. We want to give people hope as they come through the doors. And so that actually is something that I appreciated while I was working there. And so I can definitely see why it was something that you felt was important as you found a home and working there. And it's definitely something that I think is pretty awesome. I did want to get to some of these comments that
Sure.
So someone asked, so Dr. Mint asked, what piece of advice do you wish that you had received while you were coming up that you did not actually get? Because you did say that there were some things that you wanted to be able to give to other people. So what are some of those things?
I think a couple things come to mind. One is that confidence factor. You, as an early trainee, you want to do well, right? We're excellent students. We want good grades. We're used to getting good grades. We're used to working hard. But then that professional identity that's just starting to develop, having someone tell you you're doing okay. You are right where you're supposed to be. Just that sort of reassurance that you're going to feel like you don't know what you're doing, but you're growing. You're moving forward. Just that actually explicitly stated. That would have been really helpful to get, to just know that, okay, I'm going somewhere.
Yeah.
And I think too, the other piece that would have been ideal, I think very helpful for me, would have been, it doesn't just have to be this way. I think in many ways I felt reflecting on my younger self, okay, I need to do this next, and then I have to do this next, and this. And again, being someone who, follows the steps and wants the guidelines and the rules, realizing that there can be more flexibility. It doesn't have to just be this way to get somewhere. You might take a little side step, and that's okay. You can still come back to your goal. So that information, I think, would have been helpful for me.
Right. And we actually have a comment from Dr. Karen Postal. She says, you bring up such an important aspect of neuropsychology, bringing the emotions and psychology into the neuropsychology work. And that emotional connection that you talk about is so interesting. And I think that kind of fits in with what you were just saying about things don't always have to be just one way, because I think sometimes it can be that our work can be a little bit more distanced from the people that we work with, because we're just doing the assessments. And it can be, if you make it a more sterile kind of branch of clinical psych than the other parts, or the other maybe if you're doing counseling or even health psychology. So I think that actually is a really important part of that. Do you feel like you get to make a do you feel a connection with your patients? And do you feel, I guess, because of where you're at, not everybody is gonna stick around, and that's kind of just the reality of working at a cancer hospital, right? So how do you, if you feel like you have that emotional part of it, how do you navigate that when somebody might not, survive for a while, or, maybe even in the short term, they might not survive?
I have the opportunity. I often look at the feedback session as that time to really connect in a therapeutic way. But testing does as well. It provides the opportunity to connect, build a rapport, establish rapport for however many hours I'm with the patient, or in that direct connection. But certainly during the feedback session, I found that also in a maybe at a more profound way in some ways, because particularly if you're delivering news within the context of their treatment, perhaps they're already sort of maybe not getting good news treatment wise, and cognitively there may be also issues, and you're particularly, for example, like AYA survivors, things like that. I have found the opportunity to connect, and the way I often look at feedback is this is a tool in your toolkit. Okay, so I'm describing to you some of the challenges you have, maybe helping you understand how your brain is working under its, after having been exposed to X, Y, and Z. But at the same time, that could be empowering, and say, you know what? So now we know, we have the information. How can we come up with a plan together to support you, to figure out how you can move forward with the goals that will bring you meaning? And I think in those feedback sessions, I've really had the opportunity to do that on many, many, many occasions, and really grateful for that, because it sort of validates, I think provides validation in some cases of, okay, yes, you're experiencing these things, but also, again, a tool to say, well, let's look at the next steps. How can we help you move forward?
And how do you kind of guard yourself emotionally in those exchanges as well? Because you might grow fond of somebody because a lot of them are impatient and things like that. So.
And that's a very good question. That's particularly come up even as recently as December, when our team had a significant loss, very, very sudden, very unexpected. And it was someone I tested, a sickle cell patient who was coming in for a pre-transplant. I'd seen her for a pre-transplant evaluation. And that has happened, in a number of occasions over the years. Guarding myself, I see myself as someone who has the opportunity to be with a patient in a certain moment, a defined moment in time, that this is my role in that person's life in that defined moment in time. And when that time is gone for whatever reason, that was a gift. And I'll treasure that and make myself available as needed to the family should they want to follow up. We have a wonderful team here who can stay connected should they want to, as things change for their family. But I think that seeing that time with that person as a gift and for what it was. And then also that helps me sort of, because you do in oncology, particularly, you do have to learn how to protect yourself professionally so that you have more to give to others who are coming down the line, So I just look at that time as a special treasure time with that person, that family, and whatever the outcome may be, that will always, remain with me.
Definitely. Awesome.
Yeah.
We have some comments. Dr. Posta said that this is so beautiful, just you being able to express some of those things as you're talking. Here's another question from Chandler Zollikofer. Being the first and perhaps only double-boarded clinical neuropsych and pediatric neuropsych is a huge accomplishment in our community. Thank you so much for trailblazing. So Chandler asked, how did you navigate this uncharted space? And in what ways were you challenged to persevere?
Okay, so how did I navigate the uncharted space? I had great support. Again, I'm going to reflect on Dean Beebe. I'm going to give you a shout out, Dean. He said he'd watch this later. So um, um, he has done a lot of work along with a number of other neuropsychology colleagues in terms of kind of supporting students through the boarding process, and having him as a direct link was just really crucial along the way. And throughout my fellowship training, as I think it is for many fellowships now, being encouraged and through didactics and, like, so this, you're preparing for board, you're preparing to be boarded. So that was always in my mind. And then pursuing it though, actually, sitting down and studying for the exams and preparing your work samples and going to Chicago at the time for oral boards, I really had to break it down into a process, just step by step. If you look at the whole thing across the board, it would be completely overwhelming, right?
Yeah.
So it really had to be something that I said, this is step one, this is step two. That I think helped me to persevere, because it's just one little step at a time.
So now this is for those of us who have not been board certified yet. In your preparation, what did you do? You don't have to give us all your secrets and everything like that, but what made you feel ready? Number one, and then then the second part of this is, did you feel like, having gone through the ABAP process, that doing the subspecialty boarding, it was easier, or were you less nervous, just as nervous, or?
I think what made me feel ready the first time was there was something different at each stage, right? So the exam, what made me feel ready was, I don't know, I think I just got tired of studying. Said I should probably
I'm just gonna do this. We'll just see how it goes.
No, I had specific study goals, and I was like, well, I finished those goals, and when you start reviewing information and it comes to you quickly, like we're used to taking tests. I was like, it's an exam, I can do this. And I've been well prepared again in fellowship for that. So that was a great opportunity. I think the other thing is specifically for oral boards that helped me feel ready was I have two wonderful colleagues who we studied together, and that helped me feel ready as well. Being able to talk about our cases, directly with each other and getting feedback from them. And these are friends who had through training and cohorts, all along the way. So that kind of comradeship also helped me feel ready. And your second question, remind me again, your second one.
Since you did the subspecialty,
yes.
Did you feel like, having gone through the first one, it was not as nerve-wracking, doing the second part, or did you feel like just as nervous doing the subspecialty or preparing as you were for the ABAP boarding?
Okay. Yes. So at that time, it was interesting. It was spring of 2014, if I remember correctly, because I just passed the general boards, and very shortly after got the information about the new Peds subspecialty. And I was like, when I first got the notification it was coming out, I was like, oh, no, it's the last thing I want to do. But then I took a pause and I said, it's never going to be easier than now, right? As I was already in that flow of studying, the flow of preparation, in that mindset. And I said, I just got to do it. I'm already rolling, just going to keep rolling through. So I think that, just had that already build up momentum.
Okay, awesome. And did you find that it was not as bad as the first time? Or
I think so. Now, maybe because you just have more of an idea of what to expect. Any new experience, so much of it is that we just don't know what to expect, right? So, but once you kind of walk through the process once and you see, okay, this is going to be very similar, or you expect it to be very similar. You've done all you can, think about the work samples and all the details. You try to make sure you've got all your T's crossed and all your I's dotted. I think in some ways you just feel a little more prepared having gone through it. And again, for me, it was kind of a close chronologically, it was a close
Mhm.
time frame, so
Yeah.
that did help, I think.
Yeah, no, definitely. I have some friends of mine. We're kind of studying for for ABAP, and so the idea of doing it is kind of like a little bit nerve wracking. But also just finding the time to do it has been kind of challenging in
Mhm.
studying and
Mhm.
everything like that. How did you find the time then, and how do you just balance your work and life even now, just with your career and with the rest of your life?
Yeah, so those are really good questions. So finding the time, I think what I did, kind of reflecting on studying initially, when I took the exam for the general board, I don't think I have two children. Well, one is 6 and one is almost 8, two girls. And at the time they weren't, I hadn't had them yet. So I had a little more time. So, so that was a little easier to find time, just come home after work and study and um, really scheduling for me, just block it, just say, I'm going to do this and just stick to it. And try to put those parameters as much as I can. So that was kind of the key for me there. Um, and then I think now, in terms of balancing the work-life balance, which I mean, there's just will always be there, right? We hear so much about that phrase, work life, work life. Um, I really try to, it's sort of commitment to myself and to my family that my children and my family come first. And for me, pre-COVID, what that looked like was I don't do work at home if I can help it at all, especially in the weekends. Or those are only for my family.
Mm.
And I know everyone has to make different choices for themselves and what works best for them. So, but for me for me to for my children to know they are the priority. I mean, they are my priority, and my husband to know, you're my priority. That required me to really just block that time and say, no, I'm just not going to. And it also gives me a space of rest
Mhm.
and uh, reestablishing myself, that reset button over the weekend, and as much as possible, not working during the week. Because I have little ones now who need help with homework. And of
Yeah.
course, now in COVID, I do have some time to work at home, just the bleed
Yeah.
over a couple days a week is just where we're at. But again, I try to, as much as I can, just keep that established time. Like, this is your time.
Mhm.
I'm mommy now. This is mommy time.
Mm.
It's just essential for and I think about their development, I want them to see mommy working hard and mommy, has this career, and that's wonderful. But also, I'm your mom and I want to see you grow and develop and give you time. And that requires my focus and my attention, and that's what's going to matter in the long, long run,
Right.
from my perspective. So.
What would be kind of your suggestion for people who might be early career or even mid career and establishing those boundaries early, like with their workspaces and their clinics or wherever they might be working at? Like, how do they make those boundaries pretty clear?
Mhm. I think one key feature is communicating that to those you work with. And I know not like very, very fortunately in my role here, I have a lot of autonomy.
Mhm.
So I can say I can manage my schedule the way I need to, more or less. But what's helped is communicating to my colleagues and to those I work with. Um, these things are important to me. And also just maybe I think particularly kind of think about that as a cultural aspect of where we work. If it's not there, adding that or suggesting that or imparting that in some way to say, you know, we're humans, these relationships are a key to our life, and we need to uphold that, and encouraging each other that way, It doesn't make you doesn't make you lazy or less of a hard worker if you put your family first. Like it's the most important thing, for me, from that perspective. And so I think communicating that to your colleagues in that culture. And I think the other piece is helping to develop that as much as you can in the culture of where you are. I've been very fortunate. I have a director who we've since COVID, even more so since COVID, has really put an initiative on self and family care. How are you doing your well-being in your family? How's your family doing? And as much as, I mean, we're psychologists, right? We always, push that for our patients, but we have to practice it as well.
Definitely.
Yeah.
Definitely. And it's so interesting because, as you said, we tell our patients these things, but sometimes we're not the best at doing it and
Right.
those kinds of boundaries on our own, unless you're being very intentional about it. And I'm glad to hear that you are intentional about it. Just, I know that you do have a meeting in a little bit, so
it's okay.
I want to just run through. You mentioned your girls, and so do they know what you do? Do they understand what neuropsych is? And are they reading the magazines, doing like you did when you were younger?
That's such a good question. So they know what mommy does. They know mommy's a psychologist. I've said neuropsychologist, but they know mommy does something with the brain and helps kids who have learning problems. And I think those ideas are just starting to gel for them. Maybe just getting some early ideas about that. So, but it is a privilege to be able to show them, to teach them, to I used to have them pre-COVID. Everything's pre-COVID. Come to the office with me.
Okay.
On the days off and things like that. And so I hope, to be able to do that in the near future again, just to have them around the milieu of mommy's, work environment to help them learn and grow and think about, their own futures.
And have they shown any interest?
Not specifically in psychology, not yet. I mean, they're early now, so we have 6 and almost 8. She'll be 8 in a few weeks. So, they love to learn, though. I do have 2 girls who just love to learn. So I'm very fortunate and love to share with them and have that kind of dynamic with them.
Okay. And so lastly, what would be sort of your advice to anyone who is at the precipice of their career, where they're just going into neuropsych? What do you think is the most important thing for them to know that you would impart? Not everybody has the privilege of being your trainee. For those of you who are not privileged enough to be able to work with Dr. Kelly, she could give you some advice right now.
I would say authentic. That is the word that comes to mind. Be authentic to yourself. Think about what it is you really want to do, not what you think you should be doing, not what you think you should be doing because you see other people doing or because you're even, your supervisor or director or whomever said you should be doing that. Think about what it is you really want to do. And know that might change. Don't stick yourself in a hole and keep yourself there. Be willing to be open to new experiences and thoughts about what you're learning, and remember the flexibility, the flow. Because you might end up right where you always want to be, but you might be somewhere different and might be even better than you could have imagined that. So those are 2 pieces I'd say. I know those are kind of concepts and very conceptual, but be authentic to yourself. Don't do anything because you think it's just what you have to do when it comes to what really matters.
No, I think that is such valuable advice, and it's definitely something that I've had conversations with colleagues about, especially when there's this offer here or that offer there, and it might sound like this sounds like a great opportunity, but it's not necessarily what you really, really are wanting to do. And that piece of advice, being authentic to yourself, is so important. So important.
Mm-hmm. Mm-hmm.
Well, thank you so much for your time, Dr. Kelly. I appreciate this.
Yes.
Talk
Thank
to
you.
you
Thank you for this opportunity.
yeah, and have this conversation in a wider sphere so everybody else can hear just some of the things that you have been able to accomplish. And we look forward to seeing all the other great things in your research and in your career, even more so, because I know that you're not retiring tomorrow.
Nope. Nope.
So we're looking for even more things from you. Thanks so much for being here.
Thank you. Thank you, everyone. Thank you for watching.
All right. Bye-bye.
Bye-bye.